Acid reflux, the silent enemy that might be harming your health without you knowing. Have you ever felt that burning sensation in your chest that seems to rise up your throat? Or perhaps you've woken up in the middle of the night with the feeling of something coming back up into your mouth. These symptoms might be signs of something much more serious than you realize. Today, we're talking about acid reflux, a condition that many people ignore, but one that can lead to serious complications if left untreated. And it's not just heartburn. The truth is, acid reflux is a silent enemy that could already be affecting your health without you even noticing. Let's explore what it is, what causes it, the symptoms, and most importantly, how to prevent and treat this condition. What is acid reflux? Acid reflux, as the name suggests, occurs when stomach contents, including stomach acid, flow back up into the esophagus. And this isn't supposed to happen. Normally, we have a defense mechanism, a valve called the lower esophageal sphincter. This valve opens to allow food into the stomach and then closes to prevent anything from coming back up. But when this valve doesn't function properly, the acid flows upward, causing that uncomfortable burning sensation known as heartburn. It might sound simple, but trust me, if left untreated, acid reflux can worsen over time and lead to serious complications like inflammation, ulcers, or even an increased risk of esophageal cancer. What causes acid reflux? There are many causes of acid reflux, and they're often tied to our habits. For example, what you eat can directly trigger the problem. Fatty foods, fried items, coffee, chocolate, alcohol, and even soda are common culprits. Excess body weight is another major cause. Extra abdominal fat puts pressure on the stomach, making acid reflux more likely. And stress? Yes, stress is a surprising but significant factor. It can worsen symptoms dramatically. After all, who hasn't had a tough day and felt discomfort after eating? There are also specific situations, such as pregnancy, where the baby presses against the stomach, or medical conditions that affect how the sphincter works. The types of acid reflux. It's important to understand that not all reflux is the same. The most common type is gastroesophageal reflux disease, or GERD, where symptoms are frequent and can seriously impact your quality of life. The second type is laryngopharyngeal reflux, often called silent reflux. It's sneaky because it doesn't always cause heartburn. Instead, the symptoms show up in the throat. Hoarseness, chronic cough, and a sensation of something stuck in your throat are common signs. Symptoms of acid reflux. The most common symptoms of acid reflux are those many people already know. A burning sensation in the chest, also known as heartburn. Regurgitation, where acid seems to come back up into the mouth. And chest pain that is often mistaken for a heart issue. But there are other, less obvious signs too. Hoarseness or loss of voice. Persistent coughing, especially at night. Difficulty swallowing, or feeling like something is stuck in your throat. These symptoms can range from mild to severe, depending on the condition's progression. That's why it's so important to pay attention. How to diagnose acid reflux. If you suspect you have acid reflux, it's essential to seek medical advice. Diagnosis is made through specific tests, such as upper endoscopy, allows doctors to check for inflammation or damage in the esophagus. Esophageal pH monitoring, measures the acidity levels in your esophagus over 24 hours. Esophageal manometry, evaluates the strength and function of the esophageal sphincter. These tests help doctors confirm the issue and recommend the best treatment plan for you. Treatments for acid reflux. The good news is that acid reflux is treatable, and treatments can be divided into 3 categories: lifestyle changes, medications, and in severe cases, surgery. Lifestyle changes. Small adjustments can make a big difference. Avoiding trigger foods, eating smaller portions, not lying down immediately after meals, and losing weight if needed can significantly reduce symptoms. Medications. There are several effective medications to manage acid reflux. Antacids can provide quick relief, while proton pump inhibitors, like omeprazole, reduce acid production and treat the underlying issue. Surgery. For those who don't respond well to conventional treatments, surgery may be an option. The most common procedure is fundoplication, which strengthens the sphincter to prevent acid from rising. Acid reflux might seem harmless at first, but the truth is, it can deeply affect your health and quality of life. That's why it's so important to listen to your body's signals. Don't ignore persistent heartburn or that constant cough that just won't go away. Seek help, get the necessary tests, and start the right treatment. Share this information with someone you care about. A simple act of sharing could help save a life. After all, taking care of your health is the best investment you can make.